Can pregnant women really eat chocolate and drink coffee in moderation without harming their baby? What's the truth behind the idea that heartburn during pregnancy is related to the amount of hair a baby will have? Is there any scientific basis for the belief that what a pregnant woman eats can influence her baby's food allergies? Welcome back to our channel. Navigating the world of pregnancy can be an overwhelming experience, filled with uncertainties and concerns. With a lot of information available, it's easy to get lost in a maze of myths and misconceptions. Fear not, fellow mothers-to-be. Today, we embark on a journey to dispel some of the most common pregnancy myths. Myth number 1. Pregnant women need to eat for two. You know that oh-so-popular pregnancy saying that you're eating for two? Well, in reality, you only need an extra 300 to 350 calories if you're pregnant with one child and are following the daily recommended diet of 2,000 calories. If that doesn't seem like a whole lot of extra calories, that's because it's not. Those extra calories equilibrate to a scrambled egg, a piece of whole wheat toast, a half a cup of low-fat plain yogurt, and a piece of fruit, Bowles Holder says. The other thing to keep in mind, Shope adds, is that many Americans are already consuming more than the recommended 2,000 calories each day. If that's the case, you may not actually need to add all that much. Rather than focusing on calories, try to pay attention to the quality of your food choices. That can help you ensure you're gaining a healthy amount of weight throughout your pregnancy. Myth number 2. It's not safe to take a bath while pregnant. Feel free to light those candles and break out the bath bombs because this one is busted. While raising your core body temperature above 101 degrees Fahrenheit during pregnancy, especially in the first trimester, can lead to birth defects, there's little risk if you're simply relaxing in a warm bath, Shope and Bowles Holder say. That's because bath water tends to be a reasonably warm temperature instead of scalding hot like it is in a hot tub. Baths can also help relieve aches and pains that you get as your bump grows. If you're concerned, just be mindful of the water temperature and make sure you're not fully submerged the entire time. Myth number 3. Heartburn during pregnancy means your baby will have a full head of hair. I just have to smile at this one, Shope says. It's not true at all. While a small 2006 study showed that mothers who had heartburn also mostly gave birth to babies with average to above average hair growth, there was no evidence to show that the two occurrences were linked in any way. In fact, heartburn is common when you're expecting because all those lovely pregnancy hormones cause the lower esophageal sphincter at your stomach to stay relaxed and open. The more likely reason behind your baby's hair growth, Shope says, is your family history and genetic makeup. Myth number 4. You shouldn't dye your hair when you're pregnant. While it's a good idea to minimize your exposure to chemicals when you're pregnant, evidence suggests that hair dye is perfectly safe when you're expecting. The chemicals found in permanent and semi-permanent hair dyes are not highly toxic, and it is also important to keep in mind that only a small amount is absorbed by the skin, Bowles Holder explains. Myth number 5. Exercising while pregnant can hurt the baby. Quite the contrary, Bowles Holder says. Exercise in pregnancy is actually good and important for the health and well-being of both mom and baby. Shope recommends pregnant women get between 20 to 30 minutes of moderate intensity exercise 4 or 5 times a week. That said, it's important to avoid high-impact sports or activities in which you may fall, like skiing, horseback riding, and bouldering. Also keep in mind that as your bump grows, you may find yourself becoming more accident-prone as your center of balance gets thrown off kilter. Myth number 6. Morning sickness only happens in the morning. Unfortunately, the not-so-welcome nausea and vomiting that occur when you're pregnant can happen morning, noon, or night. But don't worry, they usually fade early in the second trimester. Why is it called morning sickness then? Well, the misleading nickname probably came about because having an empty stomach, like when you wake up in the morning, can make that nausea more pronounced. Shope and Bowles Holder both recommend eating small, frequent meals throughout the day to keep your blood sugar levels consistent. You can also talk to your OB/GYN or midwife for other remedies you can try. Myth number 7. It's not safe to drink coffee while pregnant. Thankfully, this is another myth that has grounds for dismissal. You can have 200 milligrams of caffeine a day, so enjoy your coffee, Shope says. What does 200 milligrams of caffeine look like exactly? It's about an 8-ounce cup of drip coffee, 2 shots of espresso, or 2 cups of tea. Myth number 8. Pregnant women should avoid chocolate. Although chocolate does contain caffeine in small amounts, as with coffee and other caffeinated beverages, it's perfectly fine in moderation. What is important to keep in mind is that chocolate is high in calories and should be used judiciously to maintain healthy weight gain and optimal wellness for women over the course of their pregnancy, Bowles-Holder notes. In other words, if you're craving chocolate, go for it, just remember to enjoy it in moderation. Myth number 9. One glass of wine while pregnant is okay. While it's tempting to have just one glass of wine or a couple of sips of alcohol during your pregnancy, multiple organizations like the American College of Obstetricians and Gynecologists say that no amount of alcohol is safe when you're expecting. That's because drinking alcohol while pregnant is the leading cause of birth defects, and it can also lead to miscarriage or stillbirth. If you didn't know you were pregnant and were still drinking up until you found out, though, don't worry. As long as you stop consuming alcohol immediately, your baby's risk of harm is likely low. When you usually find out you're pregnant, you're about 4 weeks along at that point, but you've only been chemically pregnant for 2 weeks, Shope explains. Often the embryo hasn't even implanted yet. I tell patients they should let that worry go but avoid alcohol the remainder of the pregnancy. Myth number 10. Having sex during pregnancy can hurt the baby. If you're experiencing a complication-free pregnancy, there's no reason you should abstain from sex while you're expecting. Sexual intercourse and orgasm are not associated with any increased risk of pregnancy complications or preterm birth, Shope notes. That said, there are some pregnancy complications like placenta previa that may affect how long you can safely enjoy sex. If you have any questions or concerns about this, talk to your OB/GYN or midwife for guidance. Myth number 11. It's not safe to eat fish while pregnant. Maybe you've heard about the dangers of mercury-contaminated seafood, but many types of fish are safe to eat and also good for your baby's development. Eating fish prevents preterm birth and improves neurological development, Shope says. This is particularly true for salmon, a wonderfully healthy fish to eat while pregnant as it is high in omega-3 fatty acids, Bowles-Holder adds. Shope recommends eating 2 to 3 servings of fish each week. If you're still concerned, stick to the list of approved fish published by the Washington State Department of Health. Myth number 12. What you eat during pregnancy can affect your baby's food allergies. If you avoid eating peanuts, will that protect your baby from having a peanut allergy? Or if you're craving strawberries, does that mean your baby will love the fruit, too? Unfortunately, your pregnancy palate doesn't hold quite that much power. Currently, there is no conclusive evidence to validate the reduction of allergies or food aversions by reducing or eliminating these foods in women's diets, Bowles-Holder says. If you think about it in terms of nutrients, Shope notes, any food you eat has already been broken down into amino acids, glucose, and fats by the time it crosses the placenta and reaches your baby. That's hardly enough to affect your little one's tastes. Wow, that was a wild ride through the world of pregnancy myths, wasn't it? I hope you enjoyed our journey of debunking misconceptions and uncovering the truth about what's safe and beneficial for you and your growing baby. Remember, when it comes to pregnancy, knowledge is power. By arming yourself with accurate information, you can make informed decisions about your health and well-being, ensuring a smooth and enjoyable pregnancy experience. As you continue on this incredible journey of motherhood, don't hesitate to reach out to your healthcare provider for guidance and support.